Welcome back to the House of Faith and Fashion. Right now, I'm being joined by doctor and endocrinologist specialist, Dr. Stuart Siegel from Telemed to You. Welcome, Dr. Stewart, and thank you for visiting the House of Faith and Fashion.
Absolutely. Thank you so much for having us.
This is really exciting because I believe that you can look fashionable on the outside, but if you're not taking care of yourself, no outfit is really going to help you. So, right now, you work at Telemed to You, which is a virtual medical team. And what exactly does that mean?
Yeah, so Telemed. So basically, we are a company that is all about improving access to care, right? So there's people that live in rural areas. There's people who, maybe depending on the insurance company that they have or lack of insurance, that it's really hard to get care, when you need it. And so, and we provide specialty care. So we're different in that sense that we're all medical specialists. So we're not primary care, we're medical specialty. And we have all the different medical specialists. And so, really, it's just about saying, hey, you know what? We have a platform. We can see patients, far and wide, and really get them the care that they need, no matter where they are.
That's great. So, what are you already told me what the benefits are, but maybe you could hold in some more benefits to being virtual medical care as opposed to going straight to your doctor.
Yeah, absolutely. Yeah. I mean, I think that virtual care is just incredibly convenient, right? So, I mean, when I think about, for example, my experiences seeing a doctor in person, I mean, you really have to take off work, right? So you take off work, you get in the car, you drive, you wait, and it takes like half a day just to see a doctor for maybe 15, 20 minutes. And so what we do is we provide care and where the patient is at, right? And so we people usually don't have to take off work to see us. They can see us, and it fits into their life, and that is what I think is so critical about telemedicine for our patients. And it's really, and I can see that because I can see, I mean, the show rates that we have when we see patients, the number of patients that we see. I mean, it's just they really do kind of love this way of seeing us. And I think it's just because they can actually do it. I mean, I've met many patients who have multiple jobs, and if we didn't offer virtual, they would never have been able to see us in the first place.
That's great, but can you tell us more about what the multi-conditional care that you have, multidisciplinary care that you have?
Absolutely.
Explain more that what that means.
Yeah, yeah. So telemed to you. So if we kind of take a bird's eye view, telemed to you has multiple different medical specialties, right? So it has endocrinologists, right? Has infectious disease and gastroenterology and rheumatology and neurology. But if we then focus more in on endocrinology, even within endocrinology, we have a multidisciplinary care team, right? So we don't just have the endocrinologists who are experts in obviously endocrine conditions, even diabetes, but we also have nutritionists, and we have diabetes educators, and we even have behavioral health. Did you know that people with diabetes have twice the risk of having depression than people without diabetes? And so we really provide the key support structure for patients with chronic conditions.
So what type of care would you say that you absolutely specialize in?
Me personally, it's endocrine. So what does that mean? Because I think I see a lot of
Yeah,
patients and they're like,
exactly.
endocrinologist. What is that? And so endocrinologist is an internal medicine doctor who subspecialized, so additional training in basically in conditions of basically hormone glands, right? So you have the pituitary, which is the master endocrine gland of the body. You have the thyroid, which regulates metabolism. You have the adrenal gland, which is kind of like the support structure of the body. And then you have diabetes, calcium disorders, osteoporosis. So those are kind of the bread and butter of the things that we see. Absolutely.
Well, so this falls under the big disease of diabetes, which is, I would say it's in fashion now, unfortunately.
Yeah.
So how much of an issue is diabetes in the US?
Yeah, I mean, diabetes really affects about 10%. So if you could imagine, there's more than 300 million people. That's 30 million people with diabetes, and it is definitely, from a management perspective, it's a very challenging disease, right? So you can imagine there's that many people who have such a challenging condition. Uh-huh.
Well, how do you treat endocrinology via telehealth and that you make it so not scary to people?
Yeah, I mean, I think you actually bring up a very good point, is that a lot of people are nervous to see doctors, especially when, with conditions such as diabetes, right? There's a lot of kind of, negative social stigma, kind of shame surrounding having diabetes. And people are afraid that they're going to go to the doctor and the doctor's just going to yell at them as opposed to provide support, right? And so, I think that there's kind of multiple, it's kind of a multi-prong approach to improving, and because I believe that access to care isn't just, hey, you can see the doctor. It's also providing an environment that's judgment free, that's safe for the patient. That creates access to care, because if you don't do that, the patients aren't really going to come back, because why would they want to? So our team is absolutely in tune with, judgment free zone. I think many members of our team have been touched by diabetes, personally, in their family or with their friends or even themselves. And so, we really have, an amazing team of support. And so not only do we have kind of the judgment free zone, really supportive, compassionate, clinicians, but we also make the process super easy. Right. So if you could imagine, when you see a doctor, you go to the waiting room, you get checked in, and then you get roomed, and then the doctor comes in. It's the exact same process. So we try to
Mhm.
make it feel familiar to the person, even
Right.
though in a way it's kind of like, an endocrinologist in the cloud, right? And so people come in, they get checked in, by somebody who checks them into the room. They get the usual history, and then they get
Right.
put into our room, and then we accept them and we see them. And so it's a very smooth process. And what's interesting is, actually, just the other day, I had a patient and he was skeptical. He was like, "Well, I don't know. Maybe I want to see in person." And then afterwards, one of the medical assistants, when I basically sent him back to then get scheduled for follow up, he said that this is better than in person. And I think that those are the kind of results that we see with patients, because it's just, you know I think also, in addition, people really feel, comfortable, because oftentimes we're seeing them in their home. And so it's not in this office where it's white walls and these, silly pictures up on the walls, and really just this kind of like, dry environment. It's We're seeing them there. Sometimes they have their cat in their lap, and I think I think it's a comforting way to do it.
I was just going to say that. I mean, I'm having a conversation with you and I already feel comfortable. So I can
Yeah,
imagine what your patients must feel like. But what you're doing is you're taking a lot of the anxiety out of going to the doctor. And a waiting room could also be it's too big, it's too many noises, there's too many other people there. You don't feel comfortable, and you're bringing personal care, and then I see that you can develop a relationship with your doctor a lot better this way than actually going into the office. So I really, I'm enjoying this conversation. And so I
yeah,
can imagine what your patients must feel like.
yeah,
So
yeah,
it's
absolutely.
it's National Diabetes Month and the holidays are here. So what advice can you give to prevent some of these conditions, or at least keep their conditions under control?
Yeah, I mean, I think you actually bring up a very good point, because a lot of people with diabetes, they feel, um, holidays, I can't partake in anything enjoyable. And, because I have diabetes, I just have to limit myself all the time and restrict, restrict, restrict. But I don't believe that that's true. And the reason is because, we actually kind of promote a very balanced nutrition approach, because there's multiple reasons for that. One, it works, physiologically, people's blood sugars are in balance.
Mhm.
Two, it's not restrictive, right? So people feel free. They don't feel that, oh, because I have diabetes, I can't live my life. And
Right.
then, and I think that, when I think that everybody, diabetes or not, it's all about balance, right? And so I think if you can maintain a reasonable balance, that'll help with preventing diabetes and treating and also managing diabetes. Absolutely.
Well, those are three unbelievable modules to treating this disease. But let's talk insurance because that's another scary part.
Absolutely. Yeah.
How do you do that with setting up appointments, referrals? Can you explain that?
Yeah, so there's a very special program that we offer, where we actually call it the Diabetes Care Program. And really the point of it is that, so there's unfettered access to us. So anybody who has diabetes can see us. And because, I personally, I believe I'm licensed in 46 states, right? So anybody in those states that have diabetes and they want to get care with us, they can just go online, and sign up for an appointment. We reach out and get them scheduled. But what's special about this is that it's all about, you know kind of like being on the journey with the clinician. So with me, for example, if somebody sees me, I'm on the journey with them, right? So so we see them, as usual. They have access to a diabetes educator. They see me, telemed. But then in between visits, we're monitoring their data because they have continuous glucose monitors. That data goes through the cloud into our portal. So we're actually monitoring and we're providing support continuously. Because this is not, hey, here's the meds. Let's say it's somebody who has type 1 diabetes on insulin. Hey, here's your insulin injections, figure it out. This is a
Mhm.
very challenging thing to manage, right? So we need continuous support, and things change in life over time. So many things can impact blood sugars, like stress, you know um, illness, menstrual cycles, hormone changes.
Right.
Just getting a cold can make the blood sugars go pretty extreme, or getting injections into your joints, steroids, that kind of stuff. And so, we can monitor the patient, and provide continuous adjustments to their medication regimen or nutrition plan. And so in the current state of healthcare, you see the doctor and then you see him back again in 3 months. But in with our program, that it's not like that. You can message directly to us, and we can message directly to you proactively, and we can make things improve continuously. And I believe that we get it leads to quicker resolution of high blood sugars. It's interesting because you really build this incredible relationship with the patient above and
Yes.
beyond what you can't when you see them quarterly. And this idea kind of originated when I first started practicing endocrinology. I realized, wow, we can just do a lot better. And unfortunately, telemedicine wasn't even available at that time, obviously. But now that it is, now that we have the technology, the cloud technology where we can get that continuous data, I mean, it's really game changed. And I feel like I really know these people. I mean, it's amazing, actually.
Well, that is amazing, but actually it's really important because like I said before, you're forming a relationship with your patient and your patient wants to tell you things and not hold back and feel like they have a safe environment to do that because you're allowing that. So what I can tell you is congratulations. I'll be calling you because I need a good endocrinologist. So
Absolutely. Yeah,
I'm impressed just from this interview, and I never met you before. So you can be my doctor.
hey,
But
let's
so
do it.
I'm just really excited about this. But before you go, Dr. Siegel, in my
Sure.
show, I get to ask faith-based questions. So here they are. How much
Right. Let's
faith?
go.
How much faith do you need to be in business?
That's a pretty tough question, actually. I mean, I think you have to have faith that you're going to actually achieve what you're out to achieve. So I would say actually a good amount of faith, because if you don't have faith, then you're not going to be motivated to accomplish.
That's a good answer. And do you think that your talents as a doctor are God given? And I'm going to tell you that we have three doctors in my family, so I could ask that to my son, my son-in-law, my stepson. Go ahead.
What I would say is that, my desire to help people, that's probably, innate in a way, right? But I would say that, I think that you do a lot of school, and you really have to push yourself to, go through the train to, get into med school, do all the training, complete it, push yourself through residency, push yourself through fellowship. And so
Right.
I would say that to me, it feels as though it's, I mean, it just takes a lot of hard work. So I would say that
It's
I
a
wouldn't say
combo
it's
platter.
that's right. That's right.
Okay, good. That's a good answer. But listen, you're doing God's work also, so it's through your hands. But I'm not gonna give a
Right.
sermon about the oath of Maimonides right now. But you know what I'm talking about.
Yeah, yeah, I got you.
I'm gonna skip over how you think someone should dress to a house of worship because I think
Yeah,
that's like not part of what you're doing. But if you could design a prayer for the world today, what
sure.
would it look like?
Honestly, I think it would be a song about freedom. That's what I think
Okay.
it would be, because I think that freedom is one of the greatest, things that I think in the United States, for example, because we have a lot of freedom, is that it's undervalued. And I've met so many people, especially being a doctor, I've met
Yes.
people from all over the world. And it's really interesting to hear their stories about not having freedom. And so I think that we take that for granted. So to me, it would be a song about freedom, because that's what I would wish that everybody would have.
That's a great answer, and you actually do provide that because you give your patients the freedom to live their life and stay managed by you and feel secure that they're going to be okay. So you're doing it already. It was great to have you on, Dr. Siegel, and I'll call for an appointment.
All right, sounds great. But hey, very good to
Take,
meet you, and thanks for having us.
take care.
All right, you too.
To all my visitors out there, the show is not over yet. I still have my own fashion doctor giving us the fashion RX and checking in from St. Thomas University. I'll also give you some secrets to stay in animal print and always stay chic. Don't miss out.